Hi guys, my name is Emily Easton and I'm the Four Oaks Family Connections Recruitment Coordinator. And as you know, we're putting together a bunch of resources so foster families can just know what's out there and know how to get the help they need and know all about the partnerships that are available to them. So today I'm going to here with Susan, and why don't you go ahead and introduce yourself and talk about your program a little bit.
Hi, my name is Susan Brooks, and I am the Director of Integrated Health here with Four Oaks. I am housed out of Cedar Rapids, but we actually have campuses that offer IHH services in Mason City, in Dubuque, and in Iowa City. And we cover a wide area of counties in this eastern part of the state, also in the northern part of the state and the southern part of the state. And we work very, very closely with other programs. I would say that IHH is probably the nucleus of the enterprise because there's not one program of the enterprise that IHH doesn't work with or collaborate with or have duly enrolled families or children with. What IHH is we are a community-based Medicaid funded program that services children and adults who have a mental health diagnosis and who have active Title 19 or Medicaid. We work very closely with area providers to stabilize children in the home and also stabilize young adults and adults in community-based housing in the community so they have supportive services so that they can be successful community members, but they just need extra supports to be able to do that. How we would be able to work very closely with foster parents is that many times we will get referrals internally from our own foster care staff that work with foster care providers. And we could help stabilize children in your home by getting you resources and services wrapped around those kids who have some mental health issues or behavioral health issues. We are very supportive with foster parents with school meetings. If kids have IEPs, a lot of times that's really hard and complicated for parents to navigate, especially when they have a new child into their home that is just now finding their new footing in a new environment. We can help find area providers for therapy or BHIS to help foster families feel supported with that child. We can help get the children on wait lists, such as the Child Mental Health Waiver. We also work with transitional age kids. So those kids who are 17 and a half and above, who don't have a lot of natural supports that might be aging out of foster care. We can also help with those kids find housing in the community, and that might mean habilitation services, or it might just mean extra support while they learn to live independently. So we work very closely with hospitals. We get a lot of our referrals from hospitals directly. We get a lot of referrals from schools. Of course, our internal programs in Four Oaks make a lot of referrals for kiddos and young adults who need IHH services. And we also work very closely with area providers, agencies that provide therapy or provide other services for families. We get a lot of referrals from them also. So we're very willing to work with foster parents. We feel like foster parents need a lot of support, taking on that really important role of bringing a youngster into their home. By making monthly contact with you, we have a 24/7 hotline that you can call if you're ever in need. We can help with safety plans for kiddos that are entering your home that might come in with some escalation or destabilization in their mental health or behavioral health. We can help foster families make safety plans. We can give them resources for agencies that they can reach out to. But mostly we're just here to help foster families feel like they are supported and to give them some resources to call and to interface with when they are feeling challenged by the situation.
Right, because as whether you've been a foster parent for a long time or you're kind of new to the foster care world, sometimes you have kiddos and you might see some needs, but they feel kind of overwhelming. What do I address first, and what are the next steps, and where do I go for those resources? So it seems like you're saying that IHH can come in and look at the big picture and kind of like really help spell out those next steps and find those resources to get those kiddos what they need.
We really take a very holistic approach on our support with families. Not only are we there to support the family's needs with the youngster, but we also want to make sure all basic needs are met. Is the child in need of clothing? Is the child in need of school supplies? Is the child in need of a new medication provider because they're moving from one community to a new community where that foster family is? Do they need a new therapist because they are integrating into a new community? Are they a little unsure about their community school district, who to contact? Is an IEP following them, helping them just know who to contact and know who their best resource is to just make that transition as easy as possible. That's what we're here to do to help.
Yeah, all of these resources, foster parents, we want you to know that you're not alone and we don't expect you to have every answer to everything that comes in, and we want you to feel supported. There's a village behind you to help you do these things, and IHH is one of those things for sure.
And
Uh,
we really like to get to know the foster families, and whatever the permanency plan is for the child, we
mhm.
really want to get behind that and be able to really support that moving forward.
Yeah, yeah, that's so important. You mentioned you get referrals from a lot of places. What if I'm a foster family and I have not been referred by someone else, but I would like to get involved? How could we reach out to you? What does that look like? Do you
You
need a
could
referral from a professional, or can we reach out directly? Spell that out a little bit.
we get a lot of families reaching out to us directly. They can email us at ihh@fouroaks.org, or they can call our on-call phone, which is answered 24/7 at 319-784-2250.
Okay, that's great. I always want to make sure that we're not just like this exists somewhere, but we have those, concrete next steps for anyone that's like, I would hate for someone to watch a video and be like, but how do I get to you?
Right.
So,
And
that's
many, and
great.
even if you're unsure if your child will qualify for IHH, just give us a call. We will help you walk through those next steps. We can screen the child for eligibility. If for some reason the child is not eligible for IHH services, we're going to connect you with other community partners that would be able to help you.
Okay, that's great. And when a family is working with IHH, is there a certain person from IHH that is like their contact person, or kind of what's the structure of that look like?
That's a really good question. So we provide a lot of um, just very holistic care for our families, and we want to make sure that our families know exactly who their team is. So when we have a child that enrolls with IHH, they are greeted with a team of individuals that their roles are a case manager, and also a family peer support. And we also have a registered nurse. So the family can access all three of those providers when they enroll a child with us. The case manager would really be responsible for creating a safety plan, making sure that services were in there to support the family and the child. They will create a treatment plan to make sure there's measurable goals. Those really help the families try to look forward and ahead in their treatment to make sure that their child is progressing on whatever goal they want to have be at the end. And we also have a registered nurse that will be available to the child if there's ever any medication questions that they might have, if there's a healthcare issue that they might have. The our registered nurse also interfaces a lot with the school nursing staff. So if a child comes into foster care and is needing a new primary care provider, we're more than happy to help foster families find a new primary care provider. If their immunizations are not up to date, we'd be more than happy to audit their immunization file to make sure that when they are entering a new school, that they have all their immunizations up to date, so there wouldn't be any delay in them coming into a new school. So they have a team of three individuals that really welcome the family into IHH services, and they are usually given the desk line for all for their case manager and their team, and also cell numbers are readily given out.
Yeah, as a foster parent myself, I know especially those first few weeks, there's so many logistics to manage and so many things to figure out. And so
Right.
knowing that there's someone that has experience in those things and can put you in the right direction, I think is wonderful. So
I really encourage foster families to reach out so that we can take that burden off of them.
yeah,
We really just want them to concentrate on welcoming this new kiddo into their home and let us do the other busy work for them and connecting them with resources.
yeah, that's great. This has been so informative and so helpful. Is there anything else that you just want to share with foster parents or anything that we haven't talked about?
I just want them to know that if they have any questions in helping navigate this wonderful world of being a foster parent, please reach out to IHH. Like I said earlier, we are the nucleus of this enterprise, and there's no program that we don't touch or work with. So if there's any questions that you have or a need that you have, please reach out because we would be more than happy to connect you with resources within our agency or in the community to make sure that you have everything you need. Even if IHH isn't your child isn't eligible for IHH services, we're going to make sure that you feel connected in your community so that you can feel supported. And most of all, we want our children to be successful. That's the whole mission of the enterprise is to expect success from children into adulthood. So with IHH services, we can follow the kids all the way into adulthood. So I just encourage you to reach out.
Yeah, this has been really helpful. And I'm sure it's just gonna, the more foster parents that are involved in this are just gonna feel more and more supported and cared for. So
I
I
hope so.
really, yeah, yeah.
Mhm.
So Susan, thank you so much for being with us again. IHH is an awesome resource, and we'll include all of the contact information that was mentioned, um, email addresses, phone numbers, things like that in the video description. So you all can find that information there. Um, so yeah, thank you so much for being with us. I really appreciate it.
Oh, you're welcome. My pleasure.